The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
So, Dr. Hamilton, what or who are the best candidates in terms of breast lift, and what are you really looking for?
So the ideal candidate for a breast lift is someone who is seeking a rejuvenated, higher, tighter shape to the breast, and we're restoring it back to how it originally was. This is also not someone who's looking for more or less volume. This is someone who wants essentially the same amount of breast that they have, just placed higher and tighter on the chest. So life happens, changes happen. Many women experience pregnancy, breastfeeding, weight gain, and then weight loss. And all of those can lead to ballooning of the breast and then later their deflation. And so it's essentially a restorative surgery. It's turning back the clock and helping to reset back to the way the breast used to be.
And so one of the myths, I think, which we can talk about is, okay, you have an actual breast lift procedure. In terms of the myths, I think patients often ask me, will something happen to the nipple? So specifically, nipple sensation, ability to lactate or produce milk. What do you say to patients when they ask those questions?
That's a great question, especially because there are a number of patients that have the surgery before they are considering starting families. So the vast majority of women after undergoing a breast lift are able to go ahead and breastfeed. There's a certain percentage of women, regardless of whether they have surgery, that struggle to breastfeed when trying. And so what I tell patients is just because you had surgery, you could still be one of those patients. But when you look at the percentages, and we have studies to back this up, we know that having a breast lift does not decrease your ability in most cases to breastfeed. Now, sensation, I think you can speak to this too. I tell patients you can expect the sensation at first to be a little bit decreased. At the end, it should end back to near normal, but some patients will experience reduced sensation, rarely absent sensation. Some patients will even have a little bit of hypersensitivity or more sensation afterwards, but most patients can go on to breastfeed. What's your experience?
I totally agree with you. I think it really depends on the procedure, but in general, breast lift procedures, you should be able to lactate or produce milk long term, as well as have normal nipple sensation. My understanding of anatomy as well as physiology is if you are really not able to lactate, produce milk pretty well before surgery, a breast lift may not help things, but that's simply the way that your anatomy is in terms of your own body, and a breast lift really doesn't change much.
Yes, there's causation versus correlation, right? So just because those two things happen to come together didn't mean that one caused the other one.
Right.
So you can safely get your breast lift if you want to have kids in the future.
I think so. And then also the nice thing is that in case an accident happens, in case you want to have more kids, yes, you should still be able to lactate or produce milk. You should still be able to have nipple sensation long term.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.